Hi, this video is the art of hair transplant restoration surgery on a client who flew all the way from New York for me to do the hair transplant surgery using the FUE method to recreate the hairline for him. He's thinning from the front all the way toward the back, and we're going to do at least 2,500 grafts and build the front half really strong. And if we can get more, we just march toward the back. But the front half is where all the money is. Is when people notice that you're thinning. But if you build the front really strong and you style it a certain way, it's very difficult for people to see how thin it is in the back. The reason he looked for seek me out is because the artistry of the hairline. Hair transplant, as you know, is an art form. It requires a lot of the artistic and aesthetic detail to ensure a very natural result. And for this client, on average, from the mid-eyebrow to the hairline, it's around 7.5 centimeter for Caucasian and 7.5 to 8.5. And for him, initially when we drew it, based on his facial structure, it's around, we came up around 7.25 and 7.5. I gave him that choice. He ended up opting for 7.25. And again, 7.25 centimeter to 7.5. People cannot tell the difference, but in terms of aesthetic, it makes it different. It framed the face better for at least for his facial structure. As long as the overall proportional from the mid-eyebrow to the hairline is a third, from the mid-glabella to the tip of the nose a third, tip of the nose and the bottom chin is a third. The more narrow the face, the more arched back the hairline is. The more round the face, the more flat the hairline is. Once we get the shape down, we zigzag through. And I offer the two type of hairline. One's called the soft hairline and the other one called the tight hairline. And both of them are natural. The soft hairline is more of a natural look. So we have a bigger zigzag and we use a lot more single hair graft than the baby hair. So it looks very soft and natural. The tight hairline is more of a wow factor. And a lot of celebrity and high profile people do like those. Right? So they have a smaller zigzag, tighter. And it's still, again, both hairline look natural. And so it looks sharper. And after discussing with him, he actually opted for somewhere in between. So he's going for the nice hairline, but yet not too soft. So we're gonna go in the zigzag in between of that. And once we get the type of hairline down, we will transplant a very precise angle around 35-45 in front. Increases when you go backward and change it when you go a different direction. Not only the angle, so precise angle is important, the selection of hair grafts is important. We transplant rows and rows of single hair grafts in the front, followed by groups of 2 hair, 3 hair, 4 hair in the back for bulk and volume. The angle of the hair is important, the selection of hair graft is important. And then we'll be harvesting 2,500 grafts. I will be personally pulling the hair graft out. It's a very, very important that the surgeon actually pull the hair graft out. And because if the surgeon who are specialized in the FUE method, then he should be able to pull the hair graft out and it will give the best result. Again, there's 3 groups of doctors or clinic does hair transplant, FUE. FUE is a general term in pulling one root at a time, leaving tiny dots of scar scattered throughout the back on mosaic pattern, allow you to wear your hair shorter. There's one who is specialist, FUE specialist like me. They tend to produce the best result. Why? Because we're specialized in it and we are the surgeon who's personally pulling the hair graft out. The other one called the robotic, and the artist, again, there's no way the robot can pull out as much healthy graft as I do. And that's the surgeon who cannot do it and hire a technician to operate the robots. And then there's a third group, it's a neograft. Neograft is just, machine. The doctor, they just hire some people out on the street, train them for a month or 2 and give them the degree and then allow them to pull in the hair and design the hairline. So technician do the whole surgery, pulling the hair. There's no way, there's no comparison when they design the hairline. Imagine technician design your hairline, and that can potentially drastically affect your result. So at least with me, I'm personally designing the hairline, personally pulling the hair graft out, making a precise angle and all that stuff. So this is the art of hair transplant. We're going to be harvesting at least 2,500 grafts. Thank you.